Hi, welcome to this special report from the Washington Post focused on COVID-19, the coronavirus. I'm Libby Casey, and I'm joining you from here in Washington. Let's go over the latest headlines this afternoon. Glitches are affecting those $1,200 stimulus checks that Americans have been told to watch for in their direct deposits and the mail this week. Also, the White House is saying new small business loan program is already out of money, and there are questions in Congress about just what to do next. Also, this COVID-19 is now a leading cause of death in the United States. It's eclipsed only by heart disease. More people died last week from COVID-19 than cancer, and it is on pace to become the nation's top cause of death this week. Well, President Trump is announcing guidelines today to reopen the economy. And even though he is claiming he's the one who has the authority to do it, and governors are pointing out that it's really up to them on when to reopen the states, the president says he does want to offer guidelines and move things forward with a plan. At the same time, the Washington Post obtained a draft this week from the CDC and FEMA about what those agencies believe it would take to reopen the country. We're going to dig into all of it today. And my first guest is Amber Phillips, reporter for The Fix. Amber, it's so great to see you. Thank you so much for joining us. Make sure you're unmuted as we talk here. Amber, you covered the president's briefing last night, and he is trying to take a credit and work towards the goal of reopening the economy. What are we expecting to see today?
Yeah, well, President Trump tried this week to assert that he alone can reopen the economy, which isn't true because he never put a national stay-at-home order in place. He left it up to governors. So it's up to governors to decide whether to rescind that or to keep it. And, each state is individualized. But President Trump, we're seeing, is really itching to get this economy open. May 1st is a date he's circled on his calendar, our Washington Post White House colleagues have reported. And so, after strong criticism across all levels of government and the political spectrum from him saying, yes, I can totally do this, I can reopen the economy, he backtracked Tuesday and even further Wednesday by saying, okay, I'm going to advise governors essentially on how they're going to reopen their economies. So what he's trying to do here is take a leading role in guiding governors on what works best for them. And a big part of that is expected to be these these guidelines that the CDC and FEMA are putting together, the Washington Post reported on earlier this week. Trump will announce those this afternoon. We'll have to see what they are. But according to his medical experts, if you listen to them and the coronavirus task force, it's not like a rip the Band-Aid off situation and everybody is out and about. It is something that would happen perhaps little by little, very slowly, an inch forward, perhaps an inch back. And then there's a missing puzzle piece the government has yet to address, which is widespread testing. There's still widespread shortages. And so if you're a business trying to reopen, you don't know if your employees or your customers have had the virus, whether they have immunity. Trump has been asked about this all week, and he has indicated it's up to the states to figure that out. So what I'm looking for in these guidelines announced this afternoon, what exactly how he'll address that.
I want to bring up a couple of other things that have happened in the last 24 hours that are just noteworthy from the White House beat, from what you were covering last night. There's this interesting moment yesterday when President Trump basically sort of threatened Congress and was trying to assert his control over Congress. Can you explain that tension? And that's not likely to be received well by members of the House and Senate.
Yeah, no, it's not, Libby. So President Trump started his briefing not talking about the coronavirus per se and what his government's doing to battle that, but by blasting Congress for being what's called a pro forma session. That's where lawmakers are essentially keeping their chambers open, essentially in session, but only on paper. Basically, everybody's home. They're not doing legislative business. They're not voting. They've decided weeks ago it's just not safe to be in Washington gathered at the Capitol right now. What President Trump is frustrated by is the fact that Congress is in session but not voting means that the Senate can't approve a number of his nominees to government, people he went out and said are very important to the coronavirus response. Somebody like Congressman John Ratcliffe, who he wants to be the director of national intelligence. So he sounded really angry, Libby, when he came out last night and started the briefing by saying, I'm so mad at Congress for not giving me these people. What I would like to do is just appoint them myself, skip over the whole Senate process. There's a
Mhm.
way he can do that if the Senate gets out of session, if it gets out of that pro forma session. And Trump issued the threat that you're referencing, uh, which is very unusual, to say, if you guys don't come back to Washington, vote yourselves out of session so I can make these appointments, I'm going to kick you out of session. That's never been done before in the history of the United States. It is a power that the Constitution says the president has in extreme times.
I want to point out that our colleague Mike DeBonis, who covers Congress, has this breaking news story this afternoon saying that a senior House Democrat has recommended that the House adopt a system of proxy voting remotely. That's coming from Jim McGovern. He's on the House Rules Committee. And that would really be a break with tradition, but it does show you sort of how unusual this moment is, and how members of Congress are just trying to talk about and figure out what to do next.
Yeah, and that is a big deal to have a senior House Democrat say, we can't come back to Washington, but we still need to do business. We still need, to shore up the small business loan program. Democrats want another aid bill. The Senate is the one that deals with Trump's nominees, but perhaps they need to find a way to come back and vote on those. But House Speaker Nancy Pelosi has been resistant from this for years, and especially with the coronavirus coming up. I talked to a number of House Democrats who proposed this starting a couple of years ago and got no traction. Their theories were that it's just easier for leaders to keep people in Washington and be able to tell their members how to vote, make sure they're fundraising, keeping them in line essentially. But that's all in normal times. Congress did not have a backup plan for how to vote in these extreme situations. Despite having to leave the Capitol after 9/11, for example, and figuring out a way to come back during the subsequent anthrax and terrorist scares. They don't have a plan for this, and they're kind of stuck, scattered around the country, not sure what to do. So it is notable to see some people in House Democratic leadership push this idea. I've also heard Senate Democratic leaders say they would support some kind of emergency remote voting procedure.
I want to welcome William Wan to our conversation, national correspondent covering health and science. William, thank you so much for joining me and Amber. So you were part of the team that broke the story this week about the CDC and FEMA draft proposal for reopening the country. I think everyone's hungry for an outline of just what it would look like to reopen the country. So what did your reporting show?
Sure. So this is a 36-page report drafted by FEMA and CDC jointly. It lays out this three-phase plan to reopen parts of the country in staggered fashion. So the first phase is communicating to the public. They have this messaging campaign that they outline, and then massive preparation of the healthcare system. The second is ramping up manufacturing, testing kits, PPE, and then the third phase is staggered reopening only in communities where they describe kind of categorizing communities into three kind of different communities. Those who require just low levels of mitigation of social distancing, those who require moderate, and those who require significant. So the low ones are what they're talking about reopening in that third phase. And there's dates attached to them too, which was kind of interesting. The first phase giving until May 1st, second phase until May 15th. So with the assumption that the reopenings wouldn't start until after May 15th, but there's interestingly no dates attached to when those staggered reopenings would happen. I think that's kind of a political question that they wanted to avoid.
So, William, where is this proposal going? I mean, do we have a sense of where in process it is? Because we have not been hearing President Trump come out and list a sort of bullet points that line up
Right.
with those draft proposals. As Amber's been reporting on, he's sort of been all over the place talking about other topics. So where is this in the development stage? Do we know?
Yep, so this was drafted by FEMA and CDC over the last week. We know it's been discussed at the Corona Task Force level, the White House's task force, but that comes with a caveat because of two things. One is it's just unclear how much this White House is going to listen to experts. The CDC has been somewhat sidelined during this process. The other caveat is just from the reporting we've been doing, us and the White House team, it just seems like utter kind of chaos right now in the White House in terms of the planning process. You have a lot of competing plans, a lot of competing ideas, whoever kind of has the president's ear most or last, in some cases, will have an imprint of what he says during his daily briefings. So you have this really detailed, granular 36-page report from these two agencies, but it's not certain that Trump will. He has said to the task force he hasn't signed off on list that he'll definitely listen and follow it.
William, you had a story you reported out that what American leaders are saying, what US leaders are saying, is affecting whether or not Americans choose to stay home. And that's based on data from the CDC. Amber, are we hearing the president reflect that, that realization that the direction he gives, that what he says may have a real impact on how Americans choose to go about their decisions of social distancing, wearing masks, et cetera?
He's been asked this a couple times in briefings, especially given, in early March and February, he was downplaying the virus. And he has said, I don't take responsibility for this. It is up to the states and the state leaders to figure out, what to do and how to keep their people in their state safe. So that's where this is an interesting dichotomy when we talk about reopening the economy, because Trump has been reluctant to lead on closing it, and not taking responsibility for all the things he has said about how people should feel safe, and then how they should, he wants them to be at Easter and large church gatherings, and now he wants May 1st as an option for many states. But he's totally seems comfortable taking the lead on trying to reopen the economy. He stepped out there and tried to rewrite the Constitution to say that he has the authority to do it, and has since stepped back. But he really wants to be seen this week as somebody who's guiding governors in a way that tells them what to do and when to do it.
Yesterday, the Agriculture Secretary, Sonny Perdue, was at that press briefing that you covered, Amber, trying to give a reassuring message about the food that Americans eat. But we are seeing outbreaks happen at plants. We're seeing problems happen at the origin points of where our food is coming from. And then there's just the basic question of if Americans have enough money to buy food right now. What was the Agriculture Secretary trying to communicate yesterday?
Yeah, I was looking away to pull up my notes. He was trying to say, don't be afraid if you go to your grocery store and you see that the shelves are empty. It's a reflection of what he said as a lot of people in cities, especially buying up food, and then of farmers having to transition away from producing food and selling it and packaging it to industrial locations, think like a school, for example, over to more residential commercial, like a grocery store. And I'm gonna read this quote because I just thought it was like reassuring to hear him say what I'm about to say. Don't worry about food, but it was also a surreal moment to hear a cabinet secretary for the United States of America tell Americans you're not going to go hungry. Like it was a need the Trump administration felt at this time to reassure people in light of, as you said, Libby, processing plants like one in South Dakota that processes pork having to close down, and there, disruptions to the food supply because it's tough to keep workers out there getting people their food. So here's what Sonny Perdue said. He said, in the United States, we have plenty of food for all our citizens. I want to be clear. The bare store shelves that you may see in some cities in the country are a demand issue, not a supply issue. Again, telling Americans, you might be concerned when you go to your grocery store and see bare shelves, or when you hear about these processing plants infected and having to close down, but you're not going to go hungry.
Of course, other concerns on that front, grocery store workers getting infected, a real question there, even as they're called essential, just how safe they are. And we are reporting at the Washington Post that farmers and dairy owners are having to just destroy their crop or throw out their milk because they just don't have a way to get it to market. Amber, before we let you go, what are you going to be watching for and listening for as the president tries to give these guidelines to the governors? Are you going to be watching for what the White House is saying or suggesting? Are you going to be watching for how it's received by these governors who are already going forward and making their own plans?
Yeah, that's a good point, Libby. The governors, some of them, especially the Democrats, have been very critical of the Trump administration not leading, as I said, in closing down their states and helping them get medical equipment. And so, someone like J.D. Pritzker in Illinois is saying, I've given up on the federal government helping me. So I'm curious to see if governors respond in any way to listening to this federal government, guidance other than to just blow it off. It's not necessarily a partisan issue as well. Maryland Governor Larry Hogan, a Republican, has said, or he said today, it's just way too soon for us to be opening up our economies. So at this point, the relationship is so fraught between a number of governors in hard-hit states and the Trump administration. I'm looking to see if they can even begin to work together on this.
All right, Amber Phillips, thank you so much. William, you've been reporting on how plans to defeat coronavirus have been coming out. And Amber, we'll let you go so you can get back to your reporting. Thanks so much. You've been reporting on how plans are emerging. People are trying to kind of wrap their minds around just what it would take to move forward in some sort of way. But the White House has not been the leader on this. Where are the plans coming from? Where are they originating?
Yeah, you have this crazy dynamic happening where in absence of White House leadership on direction, on plans, on guidance, you just have everybody and their mother has a plan right now. You're seeing it in op-eds, you see think tanks coming out with this. You see on Twitter, just like people doing tweet threads, like real experts, like the former CDC director, kind of in a Twitter thread, laying out point by point, this is what we should do in a country. What's really interesting is over the last probably 2 weeks, we've seen all of these plans kind of converging on 3 central pillars. And so we wrote a story kind of like laying out, from Bill Gates to Obama to, leading epidemiologists at Harvard, Johns Hopkins, Columbia, all kind of converging on these 3 central pillars of this is what we need to do as a country. And you're seeing states kind of starting to draw on that, form their own kind of plan in coalition state groups. Yeah.
And so take me through what those are.
Oh, yeah. So the 3 pillars, that would be great, is, first, just testing. Like everybody knows testing is essential, but massive testing is essential. But testing alone does nothing. It just tells you who has the virus. You have to do contact tracing. This is starting to be talked about more and more this week. But contact tracing is finding, you have one person that's infected, you find everybody they came in contact with in the last 5 days, and then have them go into quarantine. And then so that's the third step, is quarantine. So testing, contact tracing, quarantine. These are like just the building blocks of any kind of infectious disease response. So not even, you don't have to go as far as South Korea. Everyone's been talking about the advanced methods they use with cell phone tracking and apps. I talked to someone who led one of the most effective responses in Liberia. This is the head of the Liberian Ebola response. It was these same 3 pillars. The problem is in US, we don't have any other resources we need for the second pillar, contact tracing. It would take probably, there's been estimates of 300,000, 100,000 contact tracers to really figure out who we need to put in quarantine. So that's something that's going to take federal response, and there doesn't seem to be any funding, talk, movement on that yet.
I'd like to welcome Paige Winfield Cunningham to the conversation, national reporter focused on healthcare policy, and she writes the Health 202, which is a newsletter that you can subscribe to. And Paige, William was just talking about these 3 pillars, and you wrote in the Health 202 this week that we're all talking about flattening a curve, but one curve that we're seeing flatten that we don't want to see flatten is testing, and that testing is stalled. What's going on with testing?
Yeah, well, we saw this initial surge, of course, in March and then at the beginning of April. And we got up to the point where we're seeing about 130,000 tests a day performed. But the troubling thing is that number has basically remained flat over the last week, when we actually should see it continuing to ramp up. And we're even hearing that these commercial labs, which are processing about 2/3 of the tests, so think Quest, LabCorp sort of being the 2 biggest ones, they have actually said that they are performing 30% fewer tests over the past week. And this is the exact opposite of what we need to see, as the Trump administration and governors start to talk about plans to reopen the economy. This, as William said, is sort of a central pillar that needs to be in place. And we're not, there's a couple explanations possibly for why we're seeing the testing sort of stall. But we're still kind of figuring that out. One reason could be that the guidelines for getting a test are too strict at this point. So, back when we sort of had a backlog and we didn't have the capacity, the CDC and state governments came out with really strict guidelines for who could get tests. So basically, you were only advised to get a test if you were like fit in very narrow categories. You're like a medical worker who has symptoms, you're living like in a group setting. Most people couldn't get a test, and that's still the case. And so it could be that they need to sort of relax some of those guidelines so that more people will start seeking tests. But of course, there's also ongoing issues of these labs getting the materials that they need to perform the test. And we're talking about the reagents that are the chemicals needed to assess infection, and then of course the swabs and so forth that are used to collect the samples. And we're hearing reports that some states are having to still compete over those kinds of supplies. So it's kind of a lot of factors at play here, but it's definitely troubling that we're not seeing the testing go up further at this point.
Margie wrote into the Washington Post from Alameda County, California, and just got right on this. If testing, she writes, is the first step, why are authorities talking about opening things up without mass testing? And Margie says it makes zero sense. So William, how is a better path forward unless we can see this massive testing take place?
I mean, I really honestly don't know. I don't see a way for the country to reopen. I mean, the caveat being this is a very big country. There are a lot of little counties where even without testing available, you don't know what's there, but it appears from hospitalization rates that it isn't widespread yet. But the problem without testing available is, even so, say you open a Alameda County, say they have very little tests, very little cases. If you reopen it, people are just circulating normally. How do you know when they are approaching a critical mass? Because there's a 2-week lag for a lot of this. You have all of the cases starting to amass, and then suddenly the hospitals hit. And by then it's too late to get PPE. You have a New York kind of situation all over again in all these counties that you're reopening. So that is like a big problem. Yeah.
Paige, we're hearing President Trump at these briefings repeatedly say that the US is testing the most, like it's the most, the best, the biggest. So
yeah. So right. He said that repeatedly. So just numbers wise, it's true that like numerically we have performed more tests, but of course the important number here is tests by population size. And so in that, we actually are still lagging pretty significantly behind other countries. We're definitely behind South Korea, China, I believe Italy and Canada as well. In fact, we actually have tested still fewer than 1% of the entire US population. And so as much as he likes to kind of boast about this, and as much as it is true that we're ramping up testing capacity, I think most experts would agree that we're still far below where we need to be.
So it's all about focusing on the number that matters the most based on population. So William, this CDC response document that you reported on that goes through a possible plan to reopen the country talks about a first priority being schools and other places where children are cared for. Why is that seen as a key first step? And do we know how that would work?
Yeah, so the reason that they put the priority on that is because your workforce is not free. Like, without someone watching my kids, I'm not going to be able to go back to the newsroom, right? So I think that's the priority in their minds. There's some talk of the document is quite detailed in that it lays out for a moderate community, for example, you would reopen schools, but you wouldn't have school assemblies, you wouldn't have sporting events. It's quite granular, like those 3 categories, low, moderate, and significant, what the schools would look like, how you would reopen. It is really interesting. Even if Trump does not adopt this plan, what's interesting is you see these states banding together, forming coalitions to create their own plan. So in that way, that's one of the reasons we felt it's really important, even though this is an internal document, to put it out there. If you go to our website, you can read the document. I've had some state chiefs of staffs kind of emailing in saying, like, trying to find more detail, because in the absence of White House leadership, even if Trump doesn't want to give some of these guidances, some of this can get out there. It can start formulating and informing the decisions being made at the state level.
It also calls for contact tracing, something that
Yeah.
we've been hearing you talk about, William. So is there a sense of what kind of a scale of contact tracing it would take? And is what the CDC is talking about and recommending, is that in line with what outside experts are talking about?
That was kind of one thing very puzzling about the CDC plan, it called for something, I think in the hundreds, I forget the exact number, but bulking up the number of federal contact tracers that could help by the hundreds. But what we've heard from experts and these other kind of like think tank plans is we need hundreds of thousands in the country in terms of contact tracing. One, for every 4 cases, you would need 1 contact tracer working on that. That's from Tom Frieden, the former CDC director. So the massive scale that's needed still isn't addressed. But you have a lot of states starting to form this. So independent of the White House giving them any kind of guidance, Massachusetts has formed something. They put out a call for to hire contact tracing, which can really help the economy. You're hiring all of these part-time workers. Within like 4 days, I think they had 5,000 applications. They already have people working in being trained and kind of scaling up. That's one thing I just have to say is like really encouraging about all this is that, you know, we focus so much on Trump and the White House, what's going wrong, lack of leadership, but you see this incredible thing happening where, you know, you have philanthropists, you have state governors, you have like this cooperation where these state governors are always usually competing for attention, competing for like press conferences. You have to see them banding together. Business, Trump has been like pressing businesses to reopen. This week you saw businesses pushing back saying, you know, hold on, we don't want to have to like reopen just to close back down or be put in liability lawsuits with our workers. Like you see people really responsibly trying to band together and create a path forward.
All right, William Wan, thank you so much. We'll let you get back to your reporting. Paige, I want to talk to you about immunity and the question of, you know, one component of getting America back up and running is if there's herd immunity or, of course, the vaccine, or if people have individual immunity. What do we know about people who've been sick from the coronavirus and whether or not they've actually truly developed immunity, which would make them perhaps, you know, people who could lead the charge on helping to reopen the country? What do we know?
Yeah, so this is kind of like the second wave of testing that people have been talking about. So the first, of course, is just the diagnostic testing. And then the second is actually doing these blood tests where you look to see the antibodies that are there and whether they are the type of antibodies that would indicate somebody had previously had an infection of the coronavirus. I guess I would say 2 things about this. You know, on the one hand, yeah, people are really looking to this as a way to help get the country back up running. So say that you test positive for an antibody test, you can presumably safely go back to work, go back to school. You then have a segment of the population that doesn't have to worry about passing the virus along to somebody else. But as we think about this, couple of real big questions and problems on the scientific side of things. You know, I think there have been around 90 antibody tests that have been developed and that companies are starting to use and kind of perform these larger scale tests on people. But they really vary in how sensitive they are. You know, so they test for different kinds of antibodies. There's a fear that potentially someone could have, that it could sort of trigger a false positive by sensing antibodies somebody developed because of the common cold, and that could accidentally trigger these tests. There's also a question of when the antibody tests are performed. You know, people don't develop antibodies until about 10 days after they have symptoms. And so if you test too early, you're gonna get a false or negative when you would presumably get a positive a few days later. And so, given that there are so many of these tests, a lot of the labs that are looking to start distributing them have really had to spend some time trying to find the most accurate test. So I spoke with some folks at Mayo Clinic in Rochester last week, and they had spent some time looking really carefully at 5 or 6 of these tests and had finally settled on one that they're going to have their doctors use that they find is more accurate than others. So I would say, like, on one hand, yes, there is cause for optimism that these could be very, very helpful. But at the same time, I mean, I guess the other thing I should add is that we still don't know exactly how the body responds to the coronavirus and how many antibodies are developed, how long do the antibodies last? I mean, when you look at like the common cold, antibodies typically only stick around for a few months. When you look at SARS in 2003, it looks like the antibodies stuck around for about 3 years. We don't know exactly what the length of immunity is. And these tests also don't show how many antibodies patients have. So what level of antibodies are needed to protect somebody from the virus? So a lot of questions here, and we're really not going to have the answers to a lot of them for another 9 months to a year until we can actually see and track how patients, who say tested positive for one of these tests to see whether they actually are immune from the illness.
Here's a follow-up question from Jim, who writes from Alexandria and asks, so are people who, have recovered being put into some kind of a database so that, as we figure out how to truly test for antibodies and figure out what their immunity might be, that they can be identified?
Right. So this is a great question because it gets to the practical and kind of ethical and legal questions around what do you actually do? Say hypothetically, we have a really strong, scientifically sound antibody test and we're doing it widely. What are the next steps to actually help those people reenter society while keeping the people who are negative and still vulnerable to the virus practicing the social distancing? I mean, is this, people have talked about the idea of an immunity certificate or an immunity passport. China has actually practiced something like this where you have to have, I think, some kind of symbol on your phone indicating your level of risk. I know other countries have talked about this idea, something the UK has talked about, Germany has talked about, but it's really hard to see how the US would carry out something like this. For one thing, we're a very decentralized country. The states make a lot of decisions. They've been making a lot of the decisions throughout this entire pandemic. So, would you have a certificate? Would the feds do it? Would the states do it? Where would the certificates allow you to go? Would this lead to a black market where people who haven't had the coronavirus but are desperate to get back to work and feed their families try to, get a fraudulent lab to give them a test and they get an ID? So it raises a whole host of questions. And I think people are just now starting to kind of really consider that and all of those steps that would have to be taken and all of the questions that have to be answered before you could even get to a point where those antibody tests would be really effective in determining what parts of society can kind of return to work, school, etc.
Your focus on the Health 202 today is about these medical workers who are getting sick by the thousands. Reopening the country, of course, caring for the country, making sure there's adequate hospital care, adequate medical care is all a component of sort of our functioning society. So there's, of course, so much concern about how healthcare workers are faring. What kind of story did you want to tell? Why is this important to focus on right now?
Well, I think I've sort of thought all along through this pandemic that, I understand why it was hard for some Americans initially to understand why, these extreme social distancing measures were so important. Because when you looked at the numbers initially, they didn't look that bad. You're comparing, Trump himself was comparing this to the seasonal flu, et cetera. But the lens that you really have to look at this through, I think, is the healthcare system and the overwhelm that is experienced when you have a pandemic like this and you just don't have the capacity in the hospitals. And that translates directly to the healthcare workers who are then at higher risk, and they're at higher risk whether or not they have PPE. Obviously, PPE is very important, and there's been a lot of conversation about that. But I spoke to one doctor in New York who does these intubations for patients, and he still ended up contracting the virus, even though he was wearing a mask and a face shield and a full body suit. And so these doctors and nurses and aides are going to work every day realizing that this is a risk and this is part of their job. And so, it's really crucial to make sure they have the PPE, to make sure that the facilities aren't overwhelmed. And just in thinking about the importance of social distancing and making sure that our healthcare system is supported, I looked at, we have incomplete information so far about infections and deaths among medical workers, but it's looking like it's probably somewhere between 1 and 2 out of every 10 of those infected are medical workers, and we've seen sort of similar stats on that in other countries. So a hugely vulnerable population in this story, and important to follow their stories.
Yeah, and I want to point out that you explain a little bit about why they're at higher risk. Because they're just coming face to face with secretions, droplets going everywhere. So they're getting sort of a full blast dose of this, right? It's a much more intensive way to be exposed to the virus. And as we were hearing reports of people having to reuse PPE and recycle it and everything, that's also, of course, a problem, because then you're carrying it throughout the hospital or carrying it to yourself personally. So it shows both the importance of needing protective gear, but also just why these healthcare workers are so vulnerable, even as they're so crucial to all of us sort of staying healthy and well.
Absolutely.
Paige, one thing I'm interested in is how your beat has changed, because you write this daily health tip sheet, and now, I mean, it's all coronavirus. So how has your reporting evolved and changed on this?
Yeah, it really has changed a lot. I was looking back to the last time that I wrote about a non-coronavirus topic in Health 202, and it was March 6th, which actually isn't that long ago, but seems like a lifetime ago.
Long ago. Yeah.
Yeah. One thing I've been struck by is I feel like, and I try to cover a variety of health topics in my column. I cover policy, I cover public health, I cover, you name it. But I feel like this pandemic has actually highlighted a lot of the systemic issues in the healthcare system that I write about continually. So, early on in the US response, there was a lot of discussion about the bills that coronavirus patients could face, and how are they going to pay for them when we have healthcare plans with, high deductibles. Then, of course, as we saw so many people losing their jobs and record high numbers of unemployment, it brings back the fact that we have a healthcare system that is still largely employer-based, and people get coverage through their employer. And what are they going to do when they're kicked off of that? Highlighting the fact that we've got the AC marketplaces. And for some people, that's a good option. For other people, they have found it unaffordable. And so, and I guess I would add the other thing is there's been a lot of discussion about among minority groups and the disproportionate effect that on them with coronavirus. And of course, that's kind of an ongoing conversation in the healthcare space of, higher rates of pre-existing conditions among these groups and less access to good healthcare services. So it's sort of been like an interesting way to sort of take a fresh look at some of these systemic and ongoing issues in our healthcare system.
Another newsletter writer is here, James Homan, who writes the Daily 202. I have like the two powerhouse tip sheet newsletter writers here from the Washington Post with me. James, one thing that you've been reporting on, and of course the Daily 202 is really focused on coronavirus as well now, is the danger in reopening things too quickly, right? And the red flags that are being raised, both at the state level, but also within the federal government, including that leaked CDC report, the plan, causing some alarms to ring about what happens if everything moves too fast.
Yeah, Libby, good to be with you. And it's not just all those people you talked about. I should also mention the corporate world, very concerned. I talked to a CEO yesterday, kind of panicked that they're going to be kind of pushed to open too soon, and that they're then going to face liability for bringing their workers in and then having them get sick and then get their families sick. And that everyone recognizes there's no perfect answer. This, in some ways, while it is all and should be based on the science, there is an art to it. And these are fundamental trade-offs about what our priorities are as a society. In the 60s and 70s during the Cold War, they talked about the balance between guns and butter, right? How much are we going to spend on the military versus on the social safety net and the war on poverty. And that's the kind of tough balance that they face right now. And it's the jobless claims out today show basically 1 in 4 people in Michigan, more than 1 in 10 Americans have applied for unemployment in the last month. And so those pressures are incredibly strong. And that's why you do have these public health people who are writing these memos and are trying to accommodate what the policymakers want. They're trying to get people back to work, and they're saying, here's the way we think you can do it practically. Here, if you're going to reopen schools, here are 5 or 6 really kind of common sense steps that will save lives. But when you do that, be aware that there are going to be spikes of infections. And so one of the most interesting things about the secret CDC FEMA document that the Post got, which was not meant for public distribution, is, if a local area, even if they've had a low number of cases of the coronavirus, if they're going to start reopening things and scale back the stay-at-home restrictions, it is imperative, according to the government, that they have a capacity of hospital beds and doctors and nurses to be able to accommodate what in some places in the country will be an inevitable spike in cases. So it's kind of saying, even if you haven't had a huge outbreak, don't relax this stuff unless you're ready for the possibility of a big surge. So these are agonizing choices. These are the most important. Even the president has said this is the most important decision he'll ever make, and he's right. It is. People, will live or die, and people's livelihoods are depending on what the governors and the administration and the corporate world are going to do.
Paige, one last quick question for you before we let you go. JC wrote from Ontario, Canada, and asked, why does it take so long to make a vaccine? I know you could probably talk about that for like an hour because there are a lot of components to it, but in brief, I mean, is that being talked about as truly the way we will see our lives resume in sort of full-throated fashion?
Yeah, I mean, it's hard to see a return to completely normal life anytime before there's a vaccine. So I think the thought now is that we're at least 9 to 12 months away from a vaccine. And it's hard to really speed up the development of a vaccine because, to develop a vaccine, you have to grow the virus, and that just takes time. And they actually grow it in chicken eggs. They need like hundreds and thousands of eggs, and they have to grow the virus, and then they have to like go through this whole process of like isolating it. And then, of course, there's the whole FDA approval process. And I think there's probably some things the FDA could do there to speed up approval. But there's no rushing this in a lot of aspects and a lot of the steps that they have to go through.
All right, Paige Winfield Cunningham writes the Health 202 tip sheet you can get in your email inbox or find on the Washington Post website. Thank you, Paige. We'll let you go. James, you wrote today about the Massachusetts governor, Charlie Baker, who is seen as sort of a sober person, not someone who's like very emotional or very flamboyant in how he talks, but he had a very personal and emotional message as he was talking about coronavirus because it has hit home for him.
Yeah, and it was amazing because what happened was I was actually watching C-SPAN last night waiting for the president's daily news conference. And so C-SPAN was airing Charlie Baker, the governor of Massachusetts's news conference update. Massachusetts, one of the half dozen hardest hit states. And I've covered Charlie Baker a bunch. I've interviewed him, including in his office at the state capitol in Boston. And he is very mild-mannered, technocratic, moderate, kind of not, prone to drama. And most of the press conferences I was waiting for Trump to start was very much in keeping with that. And then all of a sudden he was asked about, what's the latest death count here? And he said, well, my best friend's mom just died from the COVID, he called it. And all of a sudden it was like, what, and so and it was a very poignant kind of 4-minute thing about how his friend's mom died and they couldn't have a funeral. And so, they couldn't really say goodbye the way they would have liked to. And he said that's one of the hardest things about his stay-at-home order. And then it got really interesting because, again, he's sort of a reserved guy. He's not a backslapper or whatever. And then he started talking about how in his conversations with his own dad, he started being more open and telling his dad things he wished he had told him years ago because he doesn't, he said his dad's healthy, but he doesn't know something's going to happen to him. And it really was kind of a timely reminder. Politicians are people too. These are human beings. They react more to stories than statistics, like a lot of people do. And governors especially are on the front lines of this. President Trump himself had a billionaire friend who kind of rapidly deteriorated, Stanley Chera in New York. And that clearly affected the president. It clearly shaped his decision to postpone the social distancing guidelines through April. And just clearly his friend's experience is weighing on him heavily. At one point, he paused for 10 full seconds, tearing up, choking up. He's never done that before in public. He's not John Boehner. And looking, for kind of the right words to say. And then he said, leave nothing on the table. Don't leave anything unsaid. That's my advice to everyone in Massachusetts. Anyway, I was going to write about the president's news conference. And I saw that and I said, that is a moment that captures these governors are just, everyone. So many people are facing these, if not someone in their family, someone that they know who's been stricken by this terrible invisible enemy.
I'd like to welcome William Booth to the conversation, London Bureau Chief. William, we had you sideways at first. You are across the pond, but you're still on our wavelength. So we're glad to see you upright and with us here. So talking about that personal connection to coronavirus, I mean, the entire United Kingdom got a personal connection to it through Boris Johnson. And you and your team there have written about sort of love him or hate him. People were really rooting for him to be okay. How has his illness and subsequent recovery changed the conversation or the awareness where you are about the seriousness of coronavirus?
Well, as you said, Libby, I mean, Boris Johnson being first sick and then in the hospital and then in ICU, I mean, as bad as it can get, really focused the mind here. And it got any people maybe sitting on the fence thinking, well, this is quite a very, very serious thing that's hitting everyone. I think everyone was rooting for Boris Johnson, whether they were left, right, or center. He was kind of a middle-aged guy who maybe could lose a couple of pounds, like you middle-aged guys, struggling for his life. I mean, when Boris got out of the hospital, his first thing he did was do a video thanking his nurses, one from New Zealand, one from Portugal. That's the political interesting part of this. But he said it was he said it was at a point where it could have gone either way, and either way to me means life or death. I mean, it means like it could have gone really bad for Boris, and that kind of common language and speaking, I think, resonated with people, and they had a personal connection to somebody who was their president, prime minister, leader, who was sick as a dog in the ICU. So I think that was a big moment here in Britain.
You did mention that Boris Johnson praised his medical team, including two of his nurses who are from overseas, and it does have a political angle here. We're also seeing Jennifer Hassan report on this viral video that's sweeping Britain, looking at immigrants and their contributions right now and how significant they are to saving the country, everything from in the medical side of things to just providing groceries and everything else. How is the political conversation there shaping up in that respect?
Nobody is beating up on immigrants these days in Britain, both because of the NHS, which has the National Health Service, which has tons of European and foreign-born workers. So the conversation has probably switched a little bit from any let's get rid of them faster or let's put up more walls to maybe how can we get more of them. We haven't written about it yet, but just reading in the paper this morning that they're starting kind of like airlift, like flights from Romania and Bulgaria, bringing in people to pick strawberries and blueberries and salad, which Brits don't do, much like the United States. A lot of that work is done by migrant workers, immigrant workers. And so those people are coming in airplanes to help the British feed themselves. And that piece that you mentioned about from Jennifer Hassan, which was great about that viral video, was a comedian in London, a comic in London, did this thing where he had all these little clips of people who were obviously not obviously, I don't know, they were not from born and raised. They were not not born and raised or born here in Britain, or they looked like they were not born in Britain. That was the point, right? And they said, I'm packing your groceries, I'm caring for your mom, I'm in the surgery, I'm a doctor, I'm providing things for you. And I think that was like a powerful viral video that was interesting for people to look at.
We've been watching, of course, to see what Europe does, what the UK does in terms of reopening or sort of developing or moving through this phase. And you and your team did report today that Britain decided they will continue the lockdown for at least 3 weeks. There is some push-pull there, though, William, about some conflict about just what next steps to take, much as there is here.
Yes, there is conflict here because Britain is not going to do anything for 3 weeks, whereas Europe has made some initial first baby steps to like begin to open schools or begin to open big stores where people can socially make more distance between each other. But here in the UK, it's going to remain locked down for another 3 weeks or so. But a lot of people are saying, well, okay, we understand that. We'll go for that. We see that our numbers are still not where they need to be, but you got to tell us what the next steps look like, and that is what Britain hasn't really done so well. I was looking at a video of a press conference this morning. I think it happened yesterday, of Angela Merkel, the Chancellor of Germany, and she's a former. She's not former. She's a scientist or chemist, and she was discussing, at 1.0, you're transmitting from one person to another, but at 1.2 transmissions per person, meaning more than one transmission from one to two, our health system collapses in October. At 1.2, our health system collapses in July. At 1.3, it collapses at in June. And she was kind of going into the weeds and into the detail. And I think that's what a lot of people in Britain would like to see, a little bit more of like, we know we're in it now. It's not a great time, but we'll get out of it. But after a few more weeks, after 3 weeks, what's it going to look like? And they're complaining that the government isn't giving them enough to chew on about that.
James, you've been watching Chancellor Merkel as well to see what sort of message she has, but also what the plan is.
Right. And because in some ways, Germany has been relative success, Libby. They've had about 3,300 deaths. And I watched that full news conference. I speak German. And she said, she described it as a fragile intermediate success. But what's interesting is the way, that she went ahead and said, we are going to ban all large public gatherings until August 31st, which is kind of that's a long time. You're not hearing stuff like that in the United States. She said, bars, movie theaters, restaurants, venues are going to be closed through the summer, essentially. And so small shops will start to open on May 3rd. Schools will start to gradually reopen in May. But we're, and she did, as William's saying, it was, very granular. She was saying bookstores, we will have bookstores. Those can open so that you can get books. Reading's important, but we're not going to have, and then listed some other areas. I do think, even here in the United States, again, I mentioned the contrast between Charlie Baker's news conference and the president's news conference right after it. I think it would be really refreshing for the American people to hear, a president kind of explain at that level the thinking, the science, and the R naught is the scientific term for that level of transmission. But saying we're going to do something through the end of August is a pretty remarkable step. Here, it's kind of considered bold for people, even if we assume things are going to get extended, to extend a closure through May 15th. And so that is kind of the long time horizon. And one of the other things, Germany's been kind of more advanced or faster on some of the testing. They're trying to catch up on some of the antibody testing and such, but they're definitely ahead of where we are here in the States.
James, you were writing about Senator Josh Hawley, Republican, who is looking at the UK to get ideas about just what the federal government could do to cover Americans' wages. So I'd like to hear from you what Hawley's thinking about, and then we'll get Bill to talk about how that's playing out over there.
Yeah, so it's interesting, and it'll be interesting to hear, that. So Hawley is actually, he's very conservative, and he is saying, I want to do what the UK is doing, slightly different way of pushing through the money, but basically supporting 80% of someone's salary up to the national median salary, and for everyone in the country. And the idea is to minimize the number of layoffs. And, he says desperate times call for desperate measures. We've got to adapt and adjust. He said he's been on the phone with European economists and studying sort of what worked and what didn't during the Great Depression. And so, it's a very bold thing for a conservative like Hawley to say. There are liberals, and especially in the House, who have kind of pushed that idea. Still, the Republicans I've talked to in the Senate, very little appetite for it. But he's trying to kind of move the Overton window, change the conversation to do more kind of direct wage support It would be incredibly costly. It's not something our system is sort of, that it is doing. But it's modeled off of what's happening in Europe, which William can obviously talk about more than I can.
Yeah, William, tell us more about it.
Well, in the UK, the program they put forward last week about supporting employees through this 80% subsidy to businesses. So let's keep people employed. So if a business needs some help, the government will kick in a lot of money to keep your payroll going, so you don't have to furlough people, fire them, get rid of them. And then they went further, because there was a lot of questions about that, because Britain, like the United States, has a huge gig economy, huge amount of self-employed people who aren't on the rolls of a regular company getting regular company paychecks. They came up with another plan to do pretty much the same for self-employed people, for gig workers. And these are Tories. These are Conservative Party government who have run an austerity government in the UK for 10 years, since the financial crisis of 08, 09. And these are people who don't like spending bucket loads of money. And they have just thrown a lot of money at this problem, thinking that in the short term, we're going to borrow, we're going to spend, but we want to keep these businesses afloat, because we're completely both wanting to be generous to workers and keep them going, but we are equally fearful that if we don't keep these businesses afloat, then we won't get this big rubber band elastic effect when we come out of this, where the economy shoots up again. And so we'll spend some money now, we'll take out a lot of bonds, we'll get into a little more debt than we want to get. Well, it's comfortable that for the government here, but then we'll come out of it faster. And if we don't do that, we'll be in more trouble, and there'll be a more long-lasting situation. So that's what Britain just did.
Such a different approach than unemployment, and also than the $1,200 stimulus that the U.S. is working on trying to get out. James, I just want to point out some other headlines that we're following here in the U.S. That there are thousands of OSHA complaints have been filed against companies for safety concerns over the virus, and so even people who are still on the job are really wrestling with just how to do it safe, and companies are having hard times with that. We've also been watching overseas again, Denmark, and Denmark start to do some reopening of schools. William, when we look at some pictures coming out of Denmark, though, we're talking about classrooms with just 10 students in them. It seems so inconceivable for the U.S. to do that, because we've got classrooms with 30 kids in them to space children out, to have such sort of a protective plan. Are people in the UK watching Denmark and some of these other leaders as they take steps to just start trying to reopen things?
I think in Britain, and maybe in the US, they're envious of some of these moves being made by European countries, like the slow opening up of things. And Denmark is remarkable, but Denmark is also kind of a small country with the ability to have 10 kids in the classroom. And that's not maybe reproducible every place else. In Britain, we have had a lockdown, but I've often referred to it as sort of as lockdown light. It hasn't been as restrictive as Paris or Madrid or Milan or Rome. People kind of still get around here in London, so our strictures haven't been as tough. But in terms of opening schools, we closed the schools here, and they want to open them up again for essential workers' kids after this spring holiday, which they're going to start to do. And that number of kids in school could increase in the UK, but probably not in the next couple of weeks.
James, there's been pushback to governors who've been trying to have these social distancing and stay-at-home orders. We've seen it in Michigan, we've seen it in Ohio and Kentucky, and some really astounding images of people gathering without protection, protesting, chanting "lock her up" about the governor of Michigan, and sort of fascinating politically, but also from a public health perspective. I sort of feel every public health official smacking their heads thinking, oh my gosh,
yeah, in 10 days, these people are going to be in hospitals. There's a photo from Ohio where there was 100 people protesting at the, in Columbus at the state house against the Republican governor's pretty aggressive order, and they're all like screaming at the window, and you just see the vapor, the virus coming out of their. It's really just cringeworthy to look at.
Yeah, when we look at people getting together now, we all see things we never saw before, right? In terms of transmission opportunities. Yeah.
Even when you watch old movies, you're like, don't
get away. Why are they so close to each other? Yeah.
Yeah. So one of the things that's interesting is in the last hour, a group of Midwestern governors have announced one of these new blocks, and it's all the big ones: Illinois, Minnesota, Kentucky's actually part of it, but they're all going to work together just like those East Coast governors, and then the California, Oregon, and Washington to try and ease the economy back. But it's striking because of the 5 states that have still not issued lockdown orders, 3 are in the Midwest: North Dakota, South Dakota, and Iowa, which is a notable one. And what I'm hearing more and more of, and what I've been reporting on today, is food supply concerns, because one of the biggest pork producing plants in the world is in South Dakota. It's obviously become a hotspot. We talked about it earlier this week on this special report. But now Smithfield, which owned the South Dakota plant, has also closed a plant in Iowa, which is one of the states that hasn't issued a stay-at-home order. And so, a significant number of infections there. They're running coronavirus tests on the other 1,400 employees at the plant. And the governor saying publicly, Kim Reynolds, a Republican, we want to get this plant reopened on Monday. We want to get these people back to work, even though this has sort of been a hot spot. And understandably, William was talking about how they're flying workers in to work the fields. They've had more food supply challenges in Europe or concerns than we have here. Our trucking infrastructure has been working and everything else. But all of a sudden, if you start to close down some of these big pork producing plants, again, this is that balancing act. You don't want people to get sick. A lot of the OSHA complaints are actually about food workers and workers in processing plants. And, so how do you balance that? And if you do kind of err on the side of being more cautious, are we going to start to have shortages of, pork chops and other stuff in the stores? And how do you accommodate for that? And, and then obviously separate and apart from that is the grocery stores. When there was a coronavirus outbreak at the Whole Foods here, where the exact number's a little unclear, but at least half a dozen workers at the Whole Foods on P Street in Logan Circle got the coronavirus, and so they're disinfecting the store now. So I think this might sort of end up being the next frontier of a lot of this debate about whether to reopen, because there will be a strain on our food supply.
William, before we let you go, I'm interested to get your reflections on. There's been a lot of talk here in the United States of who the essential workers are, who the heroes are of this moment. Everyone from grocery store clerks to the healthcare workers we've been talking about this hour. But there's also the question of, well, how do you actually protect them? How do you move that emotional response to effective pay, effective protection, and effective sort of reward for the risk that they're taking? Is that same conversation happening where you are? And that's the first question I have for you. And then also, what are you going to be watching over the next couple of days? What should we be looking for as the UK and Europe continue on their coronavirus paths?
I think the question of who is truly an essential worker is a very big thing right now in Britain. Just in the last 2 days, there's been a lot more focus, there's been a lot more focus by the public and the government. It's not just the doctors, it's not just the nurses, it's all these people who are working in the nursing homes and doing social care for the elderly in their home. Those people deserve much more protective equipment and much more help and much more testing than the government has given them. There's been such intense focus on the hospitals that there's 200 or 300 hospitals in England, and there's 15,000 nursing homes, and so there hasn't been the attention on these people. And these people like go to work every day. They don't have the right equipment, and they're taking care of our grandmothers and grandfathers and mothers and fathers. And so the definition of essential worker, I think here is broadened out to that, but certainly also to the guy who drives the truck, who stocks the grocery store, who does all of that. And that refers back earlier to your question about the video that kind of went viral here about I'm an essential worker and I'm the guy who delivers stuff for you and I'm a doctor and I'm this and that. And those were, a lot of those people were immigrants or the children of immigrants. In terms of what's coming next, here in Britain and in Europe, we're really waiting. We think we're right at the top of this dang plateau, and people really want to see it and kind of believe it, and it's almost there. But they want to see those numbers go flat. They want to see the beginning of that thing happen. And we're right at the edge of that. A little less so in the UK, but more so in Italy and Spain, France, and certainly Germany. Everyone's waiting for that thing to happen, and that will, all eyes will be on that, and then we'll all be off to the races. What we were talking about earlier in your program about how to ease restrictions over coming weeks and months.
All right. And James, briefly from you before we let you go, there does not seem to be unity in this country about just how to reopen. And we are seeing on, Laura Ingraham and other personalities on Fox News sort of make this false choice of the economy or dealing with coronavirus. Like, we've just got to choose the economy and worry less about people's health in some way that doesn't line up with what the experts are telling us of the measured steps. So what are you going to be watching in terms of the national conversation here to get people on the page of reopening the government with a concerted plan?
Yeah, so it's all about getting buy-in, Libby, and kind of show, that's why what I think Chancellor Merkel was doing was, is what we need here. We obviously have 50 states and federalism and everything. Right before we came on the air, there was a brand new poll that was released by Pew, and it asked people a bunch of questions on this very kind of theme. 66% of Americans are worried that the economy is going to reopen too quickly. 30-some percent, were worried it's going to not open quick enough. And then, only a very small percentage, kind of think that things are being over. On a separate question from that, only 9% of people said that the president isn't taking is overselling the threat of the coronavirus. So we can talk about the protests in Michigan, and it is cringeworthy and it's horrifying to see, that, and it is a public health nightmare. But less than 10% of the country sort of doesn't take this seriously, for lack of a better term. People kind of get that it's serious, and then the debate is, all right, what's the balance? And that's why leadership is so important, to kind of bring people along and explain to them, these are the sacrifices we're asking you to make, and we're going to make them too. And so that is what I'm going to be watching. Is, we haven't seen a lot of that kind of leadership from the president, but if there's a time to do it, it's now.
Yeah, I'm looking at one of your tweets, James, with this new Pew polling. 52% of Americans say Trump's public comments on coronavirus are making the situation seem better than it is. 39% in line with reality. 8%, only 8% say he's making the situation seem worse than it really is. Fascinating numbers there. Thanks so much to both of you. William Booth, our London bureau chief, I'll say cheers to you. And James, national political reporter, author of the Daily 202, I'll say auf Wiedersehen to you.
Auf Wiedersehen.
And thank you so much to both of you. And thanks to all of you for watching our coverage and this special report from the Washington Post. We'll be back next week on Tuesday and Thursday at 3 o'clock Eastern time with more of the top breaking news on this story. I'm Libby Casey. Thank you so much. Stay healthy and well.